Cocaine and LSD aren't your typical combo, so research on their combined effects is almost non-existent. What we do know is that they're both powerful substances that are better off used separately. If you've already mixed them, don't panic. It's usually not a life-threatening mix, but it can result in some unpleasant effects. What does it feel like? Again, the combo hasn't really been studied, so it's hard to say exactly what the effects will be. According to Drugs and Me, a site produced by the Mental Health Education Foundation, cocaine and LSD can produce undesirable effects, like overstimulation and physical discomfort. The general consensus online among people who've mixed the two seems to support this. Some say that coke takes away from the acid experience. A few report not feeling any euphoria or joy at all. Some also report flipping between feeling tripped up and coked up. Are there any risks involved? Aside from an unpleasant couple of hours, mixing coke and LSD also poses some health risks. Cocaine risks. There are plenty of known risks associated with cocaine use. According to the National Institute on Drug Abuse, there's the risk of severe medical complications with cocaine use, including gastrointestinal issues, like abdominal pain and nausea, cardiovascular effects, like heart rhythm disturbances and heart attacks, neurological effects, like headaches, seizures, strokes, and coma. Cocaine also has a high potential for addiction. Regular use increases the risk of your body developing tolerance and dependence. Though rare, sudden death can occur on first use or subsequent uses, most of which result from seizures or cardiac arrest. LSD risks. Less use can lead to tolerance, but the risk of addiction is low. Trusted source. Bad trips are one of the main risks of using LSD because they can produce intense psychological effects that can be hard to shake, including panic and anxiety, hallucinations, delusions, paranoia, disorientation, flashbacks. The effects of a bad trip can last from a few hours to days, and even weeks for some. Though rare, LSD use has been associated with a higher risk of psychosis and hallucinogen persisting perception disorder, HPPD. The risk is higher in people with a history of mental health conditions, such as schizophrenia. Risks of combining the two. Not much is known about the risks of mixing cocaine and LSD. However, both increase your heart rate and blood pressure, so mixing them may increase your risk for seizures, heart attack, stroke. Safety tips. It's best to keep cocaine and LSD separate because so little is known about how they interact. However, if you know you're going to use both at the same time or have unintentionally used one, there are a few things you can do to make things a bit safer. Test your coke. Pure cocaine is hard to get. It's often cut with other white powdered substances, including speed and even fentanyl. Always test the purity of your cocaine before using it to prevent overdose. Stay hydrated. Both substances can raise your body temperature. Drink plenty of water before, during, and after to help prevent dehydration. Keep your dose low. Start with minimal doses of each. Make sure you give each substance plenty of time to kick in before taking more. Don't do it alone. LSD trips can be overwhelming enough on their own. Make sure you have a sober friend nearby throughout the experience. Choose a safe setting. It's nearly impossible to predict how you'll feel when mixing cocaine and LSD, even if you've mixed them before. Make sure you're in a safe, familiar place when combining the two. Recognizing an emergency, call 911 right away if you or someone else has any combination of fast or irregular heart rate, irregular breathing, sweating, chest pain or tightness, abdominal pain, nausea and vomiting, confusion, aggression or violent behavior, drowsiness, convulsions or seizures. If you're concerned about law enforcement getting involved, you don't need to mention the substances used over the phone. Just be sure to tell them about specific symptoms so they can send the appropriate response. If you're caring for someone else, Get them to lay slightly on their side while you wait. Have them bend their top knee inward if they can for added support. This position will keep their airways open in case they begin to vomit. The bottom line: not much is known about how cocaine and LSD mix. Those who've tried it, however, generally give the combo a thumbs down for its uncomfortable effects. You'll definitely want to avoid mixing the two if you have an underlying heart condition. If you're concerned about your drug use, you've got a few options for getting confidential support. Talk to your primary healthcare provider. Be honest about your drug use. Patient confidentiality laws prevent them from reporting this information to law enforcement. Call SPS's National Helpline at 800-662-HELP, 4357, or use their online treatment locator. Find a support group through the Support Group Project. Adrienne Santos Longhurst is a freelance writer and author who has written extensively on all things health and lifestyle for more than a decade. When she's not holed up in her writing shed researching an article or off interviewing health professionals, she can be found frolicking around her beach town with husband and dogs in tow, or splashing about the lake trying to master the stand-up paddleboard.